Today we're going to go over a few of the complications that are possible during intravenous therapy. This is by no means an exhaustive list, but we want to list a few of the things that are possible so that you would be aware of them and know them. So beginning then with the first complication, possible complication of intravenous therapy is incompatibility. And incompatibility, what we're talking about here is that some of the solutions or medications that are being introduced intravenously are not compatible with one another. And as they interact, you get bad problems that arise from that. Basically, the two substances meet and it may make the medicine inactive. It may precipitate out of the solution. Now, you want to make sure that all the substances in an IV line are compatible with one another so that you don't end up with an incompatible element which causes a great deal of problem by negating the effect of the medicine or, once again, by causing some of it to precipitate out, which could cause other problems. So the first thing to be aware of in intravenous therapy is the complication of incompatibility of one or more of the components going into the IV line. Secondly, you want to be aware of extravasation. Extravasation basically means that the IV line has come out of the vein and is depositing the solution into the surrounding tissues around the vein. When this occurs, the patient often experiences pain, redness, swelling appear at the site of the intravenous line, and if it's not quickly dealt with, if it's not corrected right away, there is severe tissue damage that can result from this. So you need to make sure when an IV line is there and IV therapy is taking place, that the IV is firmly in the vein and has not been removed from the vein and therefore depositing the solution in the surrounding tissues. The third thing you need to be aware of as a possible complication in intravenous therapy is particulate matter. Particulate matter may be inadvertently present in an IV solution, and if it is, and it's not detected and corrected, you can have a very adverse effect then on the patient as this particulate matter then is introduced to the vein, causing distress, pain, and other issues. So things to be aware of as you are doing intravenous therapy: make sure all the fluids are compatible, that the intravenous line is firmly in the vein and has not come out and therefore depositing solution in the surrounding tissue, and that there are no particulate matters that you can see within the various solutions being introduced. Another possible complication is pyrogens. And pyrogens are bacterial byproducts that sometimes are in IV solutions inadvertently, though they have been sterilized and should not be there for whatever reason. They have been infused there, and if they make their way into the patient, the patient may experience severe fever and chills. So you need to be aware of pyrogens as well as perhaps a possible complication to intravenous therapy. If the patient comes down with severe pains and chills, this is the most likely culprit right here. And then finally, the last possible complication that we want to talk about today is phlebitis. Phlebitis refers to an irritation of the vein caused by the intravenous catheter, or perhaps not the catheter itself, but by the substance being infused. Either the catheter or the substance causes an irritation in the vein, and the patient may experience severe discomfort from this, including red streaking along the vein. And you want to be aware that this is a potential complication to intravenous therapy. So all the substances are compatible. It remains in the vein and has not come out and therefore depositing the material in the surrounding tissue, that there's no particulate matter that can be seen. Be aware of pyrogens as a possible problem, especially if the patient comes down with chills and fever, and then phlebitis and irritation or inflammation caused either by the catheter or by the substance being introduced, often known by discomfort of the patient and red streaking along the vein. If you'd like to know more about this or study further, encourage you to go to the link below this video where you can find more information and also an ebook that's available for immediate download.